Hi everyone, this is Dr.Shyam and I welcome you all to my channel Dr. Pharma. Today I will be discussing about the COVID-19 disease to which the whole world is fighting against it, and I am making this video for only the educational purpose. So let's start with the topic. So all of you know that COVID-19 means corona virus disease. CO refers to coronavirus disease. 19, it has been seen in the late December. That's why WHO had given the name at February 11, 2020. It is a COVID-19 disease. It is a pandemic disease. It is a pandemic disease which is caused by a SARS coronavirus 2. SARS refers to severe acute respiratory syndrome. Okay, severe acute respiratory syndrome. Now, why it is called as COVID SARS coronavirus 2? In 2002, the SARS coronavirus has been observed or reported in 2002, but after that there is no any new case for this. And then again in 2012, that is Middle East Respiratory Syndrome has been observed or reported in 2012, and it is seen in Saudi Arabia. Again there is no any effect after that. So you can say this is the second version, you can say, of this SARS virus. That's what is called it as SARS coronavirus 2. Is that clear? Now we will see what is pandemic, meaning of pandemic. Before that, epidemic means when any microorganism is infecting to a larger number of population within a community, right? Affecting population within a community. So you can say the COVID-19 is an epidemic when you know that it has been observed in Wuhan city of China. So that time this virus is infecting to that area or in that community only. That's what it's called. At that time you can say it is an epidemic disease. Now if any microorganism is causing damage or infecting the larger number of population, not within the community, but you can say several countries. So in short, I will make you a difference between this. Just remember, P means passport. So if you want to travel to other country, what we need? We need a passport, right? So this virus almost it has traveled all over the world. So congratulations to this virus, but it is so dangerous. Are you getting me? Epidemic means affecting a larger number of population within a community. But pandemic means when the same infection or the same microorganism is affecting a larger number of population, not only within the community but other country also, or you can say multi countries, then it becomes a pandemic. That's why it is called it as pandemic disease. Now again, endemic means to a particular community. It is infecting to a particular community. It is called it as endemic. Now this epidemic can become a pandemic, which is known as outbreak. Okay, so before you know that it is causing damaging only to a fewer population of China. After that it has been spreaded all over the world, so it becomes a pandemic and a outbreak, right? So that is a short difference between pandemic, epidemic and endemic. It has been observed that zoonotic origin. I'll tell you what is that. Zoonotic origin means when the virus is transmitted from virus animals to humans. Okay, when the virus, not only the virus, if you can say any microorganism, if it is transmitted from animals to humans, then it is called it as zoonotic origin. In addition to that, if the microorganism is transmitted from animals to the humans for the first time, then it is called it as spillover event. Okay, when any microorganism is transmitted from animals to the humans for the first time, then it is called it as spillover event. Now if you give epidemiology, you know that it is linked with seafood and wet animals, right, of Wuhan city. As I told you in the earlier also, that this virus, the first case of the virus was reported in the Wuhan city of the China animals. So it has been observed that from the animals, if the virus has been transmitted to the humans, which is known as zoonotic origin. And if the virus or any microorganism is transmitted from animals to humans for the first time, what it is called? It is called it as spillover event, right? Is caused by, I told you, pandemic disease, which is caused by SARS coronavirus, right? If you see the structure of this coronavirus, it consists of, you can see here, this are S protein, okay, or you can say S spike protein, which helps in the attachment, and these are the glucose molecules or all the other molecules, protein molecules embedded on the membrane. This is a membrane, and this is a single stranded RNA. Single stranded RNA. So you know that when the virus is ingested or inhaled by the healthier person, then the first it will attack to the respiratory system at 3 hours. So if you see the mode of transmission, it is transmitted through respiratory droplets from the infected person, and then from the fecal-oral route, that is the fecus, and it can be airborne also, according to the research, that this virus can survive in the air for 3 hours, and according to the surface, or you can say temperature, humidity of the environment, the virus can survive from few hours to the few days. And according to the research, the incubation period of this virus is about 14 days. Okay, incubation period is about 14. So now we'll see the pathogenesis of this disease. Now, as you know that it is caused by a SARS coronavirus, and I told you that it consists, you can see here, this virus consists of membrane, and these are spike protein. These are spike protein, or you can say S protein, and then single stranded RNA, and all the other glucose molecules are embedded here. Okay. So once this virus has been ingested, it will damage to our respiratory system. Now, before discussing about the pathophysiology, now you can see here, I made here the organ of respiratory system. You can see here the respiratory system consists of nose, nostrils, and then larynx, pharynx, you can see trachea here, and then bronchus, and then again the bronchus is further divided into several branches which is known as bronchioles, and which consist of the bunch of the structure you can see here which is known as alveoli. Now I have drawn here alveoli. If you see the structure of alveoli, now you can see here it is lined with the single layer of squamous epithelial cells. So it is known as type 1 pneumocytes, type 1 pneumocytes, or you can say type 1 alveolar cells, and the function of this is it helps in gas exchange. It helps in gas exchange, and you know that the alveoli helps in the exchange of gas, right? Because it consists of blood capillaries. Again, you can see here the blue color, it is called as type 2 pneumocytes cells, or you can say type 2 alveolar cells. See, it consists of septal cells, okay? It consists of septal cells. Now, the function of septal cells is that the septal cells will release the surfactant. The septal cell will release the surfactant. The function of surfactant is it will decrease the surface tension. It will decrease the surface tension. Now, when you inhale the oxygen, our alveoli is getting relaxed, or it will so that the oxygen molecules can occupy there, right? And then during exhalation, the alveoli is getting contracted. So at that time, there may be a chance that it may get collapsed. The alveoli may get collapsed. So the surfactant will prevent from alveolar collapse also. Alveolar collapse, right? So what is the function of surfactant? It will decrease the surface tension and it will prevent the alveolar damage. And this you can see here, it is a alveolar macrophages. Alveolar macrophages, which helps to remove the cell debris or any infected cells from the alveoli. So this is our short introduction about the anatomy of alveoli, and you can see here this is a blood capillaries. It is a blood capillaries, and exchange of gas is taking place. So the oxygen is taken by blood and is taken to all the other cells and the tissue for the functions, and the carbon dioxide which has been produced from the cell is given to alveoli, which are exhaled out, right? Now this coronavirus, once this is ingested, now if it is ingested to the body, the first thing is that, as you know, it will damage, or you can say travel to the respiratory system. Then the main target of this virus is it will affect our, or target the type 2 pneumocyte cell, type 2 pneumocyte alveolar cell. So I will draw here, okay? I will rub this. So suppose this is the type 2 pneumocyte cells. This is the virus, okay? Now it has been observed that this type 2 pneumocyte cells consist of receptor, okay? It consists of receptor, and name is ACE2, that is angiotensin converting enzyme. You may have heard this term in a RAS system, right? In the kidney. What is the function of angiotensin converting enzyme? It will convert the angiotensin 1 to angiotensin 2, right? The angiotensin converting enzyme is converting angiotensin 1 to angiotensin 2, and this will cause the vasoconstriction, and when the blood vessels has been constricted, it has to increase in blood pressure. The function is opposite to this, okay? The ACE2, the angiotensin converting enzyme 2 will convert angiotensin 2 to angiotensin 1 to 7. It will convert angiotensin 2 to angiotensin 1 to 7, and the function is opposite to that of this, that of angiotensin 2. It will cause the vasodilation, that will decrease the blood pressure, okay? So I'm not discussing more detail about that, just remember that. And this spike protein which are present on this coronavirus, it has the strongest affinity to bind with this. It has the strongest affinity to bind with this ACE2 receptor. Now suppose it will come, so this is your virus, right? Now they will get bind with, this receptor, and they will get fused here. They will break the membrane and they will enter into the cell. Remember that they are affecting which cell? Type 2 pneumocyte, right? After this virus enters into the cell, they will release its outer coat. They will release the outer coat, and as you know that it consists of single-stranded RNA, and they will release the single-stranded RNA. Okay? Now this will hijack our ribosome or transcriptional ribosome. What is the function of ribosome in our body? It helps in the protein synthesis. From that, this will form polypeptide proteins. It will form polypeptide proteins. Okay. By the help of this polypeptide proteins, this virus will form all the other structures which are needed for their formation. Okay, so they will form here spike protein and then membrane structure, right? Whatever the structure is needed for the new virus, all these are formed by polypeptide protein. And this RNA, by using RNA dependent RNA polymerase, by using this enzyme. What is that enzyme? RNA dependent RNA polymerase. They will form a number of RNA strand. They will form a number of RNA strand, right? Now, all the other structures have been formed here, so they will form a new coronavirus here by the replication. Okay, by the replication they are forming a number of new coronavirus. So number of new coronavirus has been formed and released from this pneumocyte cell. Released from this pneumocyte cell. Are you getting me? Now see here. When there is release of this virus from this type 2 pneumocyte cells, there may be a cell damage or the cell may get burst. Okay, and as you know that when there is any damage to our cell or the tissue, there is a release of pro-inflammatory cytokines. There is a release of pro-inflammatory cytokines. Now this will activate the alveolar macrophages. This will activate the alveolar macrophages, and from here there is release of different cytokines. The alveolar macrophages will release different cytokines like interleukin 1, interleukin 6, and TNF factor, that is tumor necrosis factor. Okay. Now these cytokines, what they will do? They will travel to blood capillaries and increase the vascular permeability. They will increase the vascular permeability. Now once the vascular permeability has been increased, you had seen in the inflammation also. I hope you must be knowing in acute inflammation, due to the inflammation there is a vasodilation and there is an increase in the vascular permeability. Why? Due to release of chemical mediators. So what will happen? This fluid will come out to the interstitial space. Interstitial space, right? The fluid is coming out to the interstitial space, right? Why? Due to increase in vascular permeability. Up to here it is clear. I will wrap this. I hope it is clear. Now see here. There is an accumulation of fluid, we can say plasma, in this interstitial fluid. So accumulation of fluid in this interstitial space, accumulation of fluid, it will cause decrease in gas exchange. Yes or no? The gas exchange is taking place normally, so smoothly when the cell is normal. Now due to increase in vascular permeability, the plasma is coming outside and they will block, right? So there will be decrease in gas exchange, it will lead to hypoxemia. Hypoxemia, okay? What is hypoxia? Decrease in oxygen level, right? Or decrease in adequate supply of oxygen. So when there is decrease in oxygen supply in blood, it is known as hypoxemia. Why? Due to the accumulation of fluid in the interstitial space. So there may be a hypoxemia to the patient. Now see, the fluid which has been accumulated in the interstitial space, the fluid which has been accumulated in the interstitial space, it can travel to this alveoli also. You know that it will be accumulated in and around the alveoli. It can damage to the alveolar wall, and this may get accumulated in the alveoli, inside the alveoli. And you know that if there is accumulation of fluid in the alveoli, it will lead to pneumonia. That will lead to pneumonia. So the patient will have pneumonia also due to this accumulation of fluid. And then see here, suppose this is your alveoli, right? See, what is the difference between alveoli and the alveolus? There is not any major differences there. The alveolus is singular, where the alveoli, it is a group of alveolus. Okay, right? So this is the normal alveoli. Now, due to the accumulation of fluid, and you know that there is a damage to the cells, type 2 pneumocyte cells, there will be an irregular thickening of the tissue. There will be, you can see here, this is a normal alveoli. There will be an abnormal thickening of the tissue, irregular thickening of the tissue between the alveoli. Okay, and this irregular thickening of tissue, between the alveoli is known as pulmonary fibrosis. Is known as pulmonary fibrosis. Okay, so there is chance that the patient may have pulmonary fibrosis. Now sir, if you see the alveolus, suppose this is a single alveolus, there may be or it may consist of, you can say, cell debris, or you can say dead cells, and then fluid. You know that the fluid has been accumulated, or it is transmitted, right? And then several proteinous material inside it. So this will make hard, or you can say consolidation may takes place, which we can see in pneumonic patient also, and most commonly in COPD patient. Consolidation means this accumulation of cell debris, fluid and proteinous material, the alveolus will become hard in nature. Then what will happen? If the alveolus is consolidated, then what will happen? There will be again decrease in gases exchange. So when there is a decrease in gas exchange, there will be a decrease in the partial pressure of oxygen, which will stimulate the chemoreceptor, and then it will stimulate the sympathetic activity. And once the sympathetic activity has been increased, our heart, the heart will pump more. The heart will pump more to meet the oxygen demand. That is why there will be increase in heart rate. Is that clear? There will be an increase in heart rate. And you know that there is So due to this cell debris and fluid accumulation, there will be a mechanical stress to this alveolar wall also. Due to the release of cytokines and then the cell debris, there will be a mechanical stress to the alveolar wall, and this can lead to cough. You know that if there is any irritation to the alveoli, right, or you can say any part, it will lead to the cough, right? So there is a cellular damage, right? So due to the release of cytokines, they will recruit a neutrophils, or you can say WBC. They will recruit a neutrophils, or you can say WBC, to the site of the infection, right? Now these neutrophils will release the reactive oxygen species and then protease. Are you getting me? The WBC has been recruited at the site of infection, and once it comes to this part, they will release the reactive oxygen species and the protease. Why? To kill the virus as well as to remove the infected cells, or you can say virus infected cells. At the same time, this can also damage to our type 1 and type 2 pneumocyte cells. Are you getting me? At the same time, it can damage to our type 1 and type 2 pneumocyte cells. Right? Now, this interleukins 1 or 6, it may travel to the hypothalamus. What is the function of hypothalamus? The function of hypothalamus is that it will regulate our body temperature. Once the interleukins has been traveled to this, there is a release of prostaglandin from the hypothalamus. Release of prostaglandins from the hypothalamus, which will increase the body temperature. Leading to fever, right? So you can see fever to this patient also who is suffering from this coronavirus disease, right? And then these cytokines may be distributed all over the body. Now here it is causing only a local inflammation to our respiratory system. Now the cytokines has been distributed all over the body, then it will cause the cytokines when distributed all over the body, or if it is spreaded all over the body, then there will be a systemic inflammation. Okay? This systemic inflammation can lead to shock also. Or we can say that due to the inflammation or due to the distribution of the cytokines all over the body, our body will not get the sufficient blood supply. To the respective cells and the tissue. That will lead to shock. So what is shock? Shock is a medical emergency in which our body cells and the tissue are not getting the specific blood supply, or you can say adequate blood supply, which can lead to, so shock can lead to what? If our body cells and tissue are not getting the blood supply, of course the cells and tissue will be damaged. It can lead to multiple organ failure, or you can say multiple organ damage. So this is how the pathophysiology of coronavirus has been studied. Okay, so this is a short discussion about the pathogenesis of coronavirus disease. I hope it is clear to you all. As I told you, in between the squamous epithelial cells, it consists of type 2 pneumocyte cells, right? Type 2 pneumocyte cells. It consists of septal cells, right? and septal cells will release the surfactant. Is releasing the surfactant. What is the function of this? It will decrease the surface tension and it will prevent from alveolar collapse. Alveolar collapse, right? As I told you, when we are exhaling the carbon dioxide, our alveoli is getting contracted. So there may be a chance that the alveoli may get collapsed. So the septal cells is releasing the or producing the surfactant, which is decreasing the surface tension as well as preventing from alveolar collapse. Now you know that the coronavirus mainly it is infecting our type 2 pneumocyte cells or type 2 alveolar cells. So what will happen when the type 2 pneumocyte cells is infected? So this will not release, or they can only release a few amount of surfactant. So there will be decrease in release of surfactant. So when there is decrease in release of surfactant, it will increase the surface tension, and when the surface tension has been increased, there may be a chance that this can lead to alveolar collapse. So this can also lead to the alveolar collapse. So that is all about the pathophysiology of this coronavirus. If you see the signs and symptoms, as you know, it is a fever. The patient might be asymptomatic for a few days, and then headache, then cough. Patient may have dizziness, nausea, vomiting, diarrhea, and then sore throat, dyspnea. What is dyspnea? Or you can say dysphonia. It is a shortness of breath. The patient may have chest pain. And as you had seen, there may be an increase in BP, or you can say increase heart rate, sneezing, right? And as I have discussed, there may be a pneumonia, pulmonary fibrosis, right? And at last it may lead to the multiple organ damage or the multiple organ failure. Diagnosis of this disease, to test for the blood test, and then sputum is taken from the patient, and the special swab is taken from the nose and the throat of the observation. And the tracheal aspirate means, it is a thin tube with torch. It is kept in the mouth, and the sample is taken from the lungs. Nasal aspirate means saline solution is injected into the nose, and the sample is collected with light suction. If you see the management, there is no any specific medications till now. All the scientists all over the world are working hard for that, and the US Food and Drug Administration, had given the permission or grant the permission for using antimalarial drugs like hydrochloroquine and the chloroquine. The antiviral drugs such as remdesivir has been using now. It has been used to eradicate the Ebola virus also. The treatment is directed to relieve symptoms, to relieve the pain. There are various types of NSAID. Ibuprofen and acetaminophen is used most commonly. The cough syrup has been used because you know that the symptoms is cough also, and the patient has to take a lot of fluid, and they have to take the rest. And as you know, the prevention, we have to keep the social distancing, we have to wash our hands properly. Once you go out, you have to use the masks. We should not touch our facial parts and the eyes, right? And once you come inside, so that is all about the description of COVID-19. In the previous only I mentioned that this video I am making just for the educational purpose. Hope you like the video. Please like, share, subscribe, and don't forget to comment on the video. Thank you all.